Hi, I'm Abdul Saad, clinical psychologist at Vital Mind Psychology here in Sydney, Australia. And today I come to you with my third video in this series that I'm doing on depression. In the first video, I outlined the symptoms of depression that come together to form an identifiable depressive syndrome or disorder. In the second video, I've introduced an earlier theory or model of depression called the psychoanalytic model of depression from the writings of Sigmund Freud. And in today's video, I'm going to be introducing the cognitive behavioral model or the cognitive model or the cognitive theory of depression. Now, the cognitive theory of depression was developed in the 1970s by an American psychiatrist by the name of Aaron Beck, and I believe that Dr. Beck is still alive. He'd be well into his 90s now, and he essentially began to see in his practice that individuals who suffer from depression have a characteristic way of thinking. And he then developed a theoretical perspective, which has now blossomed into a therapeutic modality or a therapeutic approach to intervening with mental disorders called cognitive behavioral therapy. So Dr. Beck recognized that his depressed patients have a certain biased way of thinking, of processing information, and his theory and his model, which I'm going to explain, is based on that primary observation that he made. So I'm going to go through the model that I've written out on the board and also go through an example of the cognitive theory of depression. So the cognitive theory clearly states that the symptoms of depression are being driven, and the distress that the depressed individual is feeling is driven by his or her habitual way of thinking, their patterns of thinking, which create heightened levels of distress and lead to dysfunctional behaviors when the individual is depressed. And his model begins with the fact that in our early life experiences, if we've suffered negative life events, deprivation, loss, these set the stage for the development of negative core beliefs. And the more technical term for these are called schemas. And schemas, very simply, S-C-H-E-M-A-S. Schemas are sort of like these cognitive structures that act as stereotypes for how we filter information about the world. And in Beck's theory, the negative core beliefs, I guess, distill into three core beliefs in three core domains about life that the depressed individual begins to have. And this is what Beck called the negative cognitive triad, regarding the negative beliefs about the world, about the self, and about others. So in his model, in his theory, early life experiences sensitize the individual to begin to have a set of negative core beliefs. Now, these negative core beliefs about the world, self, and others act in a very indiscriminate way. They are applied universally. So, for example, negative core belief about the world is fundamentally unfair. The world cannot meet my needs. Whatever I attempt in the world is going to be met with failure. So that's that, and you can see that these are very negative universal beliefs that are very black and white. Negative core beliefs about the self are also universal self-statements such as I'm unlovable, I'm defective, I'm stupid, I'm dumb, I'm ugly, whatever the case is. But there's a universal, general, absolute quality to these negative core beliefs. And the negative core beliefs about others, for example, others can never meet my needs, others will not respect me, I cannot get along with others. So in Beck's theory, these form, and they can remain dormant. These negative core beliefs regarding the world, the self, and others can remain dormant until the individual experiences a stressful life event. So the circle I've outlined here is this represents the depressive, what's happening when the person is in the midst of their depressive episode. And what is at the top here are what we could call the developmental antecedents. What preceded, what set up the vulnerability for the depressive episode are these negative core beliefs regarding the world, the self, and others, which a stressful life event triggers for the individual. So a stressful life event, and I'll go through an example, triggers a set of negative automatic thoughts which are informed by, which are being fed by the negative core beliefs which have been triggered. And that then leads to a set of negative emotional states, negative behaviors which reinforce one another. So let's go through an example. Let's say that an individual in the early life experienced some level of deprivation, loss. Let's say that they were bullied at school. They perhaps suffered from some level of academic difficulty. That sensitized them to form some negative core beliefs regarding, if we focus on the self, that I'm defective, I'm unintelligent, I'm worthless, others will not or do not respect me, and whatever I do in life, whatever I do in the world, fundamentally will fail. It's doomed. I'm not going to be effective in the world. Now that person has a stressful life event, and let's say they lose their job. Pretty stressful. Now that stressful life event triggers the underlying negative core beliefs about the world, the self, and others, and leads to the individual experiencing what's called negative automatic thoughts. So the individual begins to automatically process and think about their situation in a habitually negative way. So they might begin to have negative automatic thoughts such as, I always fail at everything, nothing is going to work out. So for example, the thought, I always fail at everything, is an example of the person generalizing. That's a cognitive distortion or a thought error. The fact that they've pinned all of their self-worth as a human on their job shows a level of black and white thinking. I'm never going to get better. This is going to go on forever. Hopelessness, and also there's an element of catastrophic thinking. So in the cognitive theory and in the cognitive behavioral model, therapists will teach the patient to identify and begin to label the cognitive distortions within the negative automatic thoughts. Because these cognitive errors, these cognitive distortions, then feed into and create the negative emotional states we see in depression. So if I think I failed, nobody respects me, well, obviously I'm going to be feeling depressed, I'm going to be feeling down, sullen, blue, and you'll notice that the arrows are bidirectional, and that's going to reinforce the negative automatic thought that I'm having about myself. That feeling will also feed, which is being fed by the negative automatic thought, that negative feeling will also feed negative behaviors. And then the key negative behaviors behavior in depression is one of avoidance, where the individual begins to disengage from previously enjoyed activities. And activities which in the past promoted a sense of mastery or competence. And as a result, the individual begins to lose the positive reinforcement that they can gain from their environment, which of course feeds back into negative automatic thoughts about themselves, about the world, and about others. So the cognitive theory of depression is quite a neat theory. There's a lot of evidence for it. There's decades of research backing up the cognitive theory, and it has been the foundation for a very, popular therapy that's now taught all across the world called CBT, or cognitive behavioral therapy. And in cognitive behavioral therapy for depression, the therapist will usually begin by targeting the negative automatic thoughts, feelings, and behaviors in terms of getting the person out of their depressive episode. If the individual is in a very severe depression, where it's not where it's more difficult to target or access their negative thoughts, often in cognitive behavior therapy, we will target their avoidant behaviors and get them to start to structure activities and get them moving a bit more, and then work on their negative automatic thoughts, which improves or lessens the feelings of depression and despair. Now, once the individual has started to be able to monitor and becoming aware of their habitual negative patterns of thinking. The therapist teaches the individual how to challenge these negative automatic thoughts by looking for evidence that goes against them. The individual is structuring and sticking to an activity schedule. Then there's a phase in the therapy where we begin to look at, well, what are these negative core beliefs linked to early life experiences which have sensitized you to these depressive episodes? And that's called schema-based work or core belief work, where we begin to uncover these negative universal core beliefs the individual holds, which actually make them susceptible to depression moving forward. So hopefully that has given you an insight into the cognitive theory of depression and the cognitive behavioral model of depression. It's called cognitive behavioral, CBT, because it's the link between our thoughts, our feelings, and behaviors. In the next video, I'm going to be talking about a much more biological based model of depression, which looks at the role of inflammation in the activation and in the maintenance of depressive episodes. So hopefully by the end of that video, we will have covered the conceptual framework for depression, 2 psychological models, and next week, God willing, a more biological look at some of the more cutting edge theories regarding the development of depression. Now, of course, the psychological and the biological models are not opposed, but what they are doing is that they are describing this phenomena at different levels of understanding, and of course those levels interact. So this isn't an opposition between psychology and biology, and I'll make that more clear hopefully next week. Okay, thanks again for tuning in. Thanks for watching. Subscribe to the channel if you haven't. Also, go to my Facebook page, type in Vital Mind Psychology. I'm putting up a lot more posts, tips and insights there. I've also recently done a live video, and also if you want to get in touch with me for the live online coaching sessions, you can do that through vitalmind.com.au. Thanks again. Catch you next week, God willing. Bye-bye.